So for those who've joined us for the first time, just to give you some background about our organization, Elder Abuse Prevention Ontario has a vision where all seniors are free from abuse, have a strong voice, feel safe and respected. And we achieve our mission through raising awareness, delivering education training such as today's webinar, and we work collaboratively with our community partners, both in community and across provinces and across boundaries in terms of the United States and beyond, to try to work collaboratively and do advocacy and coordination of services to improve the health and well-being of older adults in our society and combat ageism, which is a big problem, as many of you are aware of. So I'm pleased to be joined today by our two speakers, Ashley Flanagan and Celeste Pang. So I'll begin to do a short introduction of Celeste. Celeste is a senior research officer for the 2SLGBTQI Health, Aging and Housing in the research department at Egale, Canada, Canada's leading organization for 2SLGBTQI people and issues. Celeste is trained as an anthropologist and ethnographer and has a research focus on intersections of aging, disability, gender, and sexuality and care. Over the past 10 years, Celeste has led and collaborated on multiple projects that consider access and equality in relation to health and aging, including ethnographic research focused on LGBTQ older adult situations in long-term care, and mixed method research on palliative care, end-of-life care, and intergenerational storytelling. Celeste earned an MA in Anthropology and Collaborative Specialization in Aging, Palliative, and Supportive Care across the lifespan from the University of Toronto, and completed her PhD in Anthropology with Collaborative Specialization in Sexual Diversity Studies. So welcome. And we're also joined by her colleague, Ashley Flanagan, is a research fellow in the Diversity and Aging at the National Institute on Aging at Ryerson University, which is a think tank focused on leading cross-disciplinary, evidence-based and action research to provide a blueprint for better public policy and practices needed to address multiple challenges and opportunities presented by Canada's aging population. At the National Institute of Aging, Ashley's research focuses on 2S LGBTQIA+ aging and old age, with the goal of advancing comprehensive health and wellness policy, programs, and services for older adults with diverse gender and sexual identities. Ashley completed her PhD in aging, health, and well-being at the University of Waterloo. She's also a member of the Ontario Centre for Learning, Research and Innovation, supporting diversity and inclusion in long-term care at the advisory group. So welcome both of you to our session today. And I apologize to the ASL, I meant it's a little too fast. So I'm going to turn it over to my colleagues now to begin the presentation. And I will go off the camera. Again, if you have any comments, please put them in the comment box. And as we do the presentation, we welcome your questions throughout the webinar.
Wonderful. Let me just share my screen.
Perfect.
How's that view for all of you? Excellent. Well, welcome everyone. Thank you so much for the invitation, Ryan, to Ashley and I to present today. And for all of you who are joining, we wish we could see you. We're imagining you all listening, hopefully having some lunch right now. As Ryan mentioned, the presentation that we'd like to give today is titled Coming Together to Support 2S LGBTQI People Living with Dementia and Their Primary Unpaid Carers. And this is results of research which are undergoing preliminary analysis that Ashley and I conducted working for the NIA and Egale over the past year.
And I just want to welcome or echo Celeste's welcome. Oh my goodness, here we go, starting off strong. And we're really looking forward to sharing the next hour with you all. But before we dive in, we want to begin by kind of providing an overview for our conversation today. So today we're going to be starting with establishing some key terms and concepts, and then we're going to follow that with an overview of our research study and what we did. And then we'll share some of the preliminary findings and the key takeaways from that research before wrapping up and sharing with you some of the next steps of the research project.
So to start us off, a few key terms and concepts to make sure we're all working from a similar page. So first, what is 2SLGBTQI? So this acronym stands for Two-Spirit, Lesbian, Gay, Bisexual, Trans, Queer Questioning, and Intersex.
Yeah, and so when we start to think about dementia, population aging, and unpaid care, it's no secret that Canada's population is aging. In fact, recent population projections estimate that the proportion of older adults living in Canada could increase from 17.5% as it was in 2019 to 23.6% in 2038, gradually increasing even more until 2063. So as the aging of the baby boom cohort kind of continues to influence our population distribution within Canada over the coming years, we'll also see an increase in the number of people living with dementia. In particular, there are over just about 420,000 people over the age of 65 that have been diagnosed with dementia, according to the Government of Canada's National Dementia Strategy report. And while this report calls for a greater focus on LGBTQ2 individuals, the prevalence of dementia among 2SLGBTQI people is not known at the moment. However, it can be expected that this prevalence is also going to increase as the population ages. And according to projections by the NIA, the number of Canadians providing unpaid care, whether within the context of dementia or beyond, is also anticipated to increase. And this is significant considering that nationally, unpaid carers provide approximately $9 billion worth of care. And that was in 2019, and the number is going to continually rise as the years go by. And so keeping all that in mind, it's imperative that we heed calls to provide equitable and comprehensive support and care for people living with dementia and their unpaid carers, especially when we take that alongside the increasing acknowledgement of diversity within Canada's older adult population.
So picking up from there, and we'll delve into this further in relation to our research findings, but some helpful background about 2SLGBTQI experiences and approaches to care, which we have to say at the outset are extraordinarily diverse. And there are many communities within communities and very divergent experiences. However, we can look at some common patterns and some kind of dominant norms and frames that we have in Canada that impact upon access and equity. I'm just going to pause for a moment. I see the ASL interpreter is paused on my screen. Is that the case for you, Ashley?
Yeah, on mine as well.
Okay.
No, sorry, we're good. We're fine.
We're fine. Okay, thank you. All right, everyone, let's continue. So one key piece are histories of criminalization and pathologization of 2SLGBTQI communities and ongoing conditions of marginalization and oppression that continue to limit access to care for differently situated 2SLGBTQI people. And this criminalization and pathologization matters and has an impact on individual and societal levels. So for example, older adults today, earlier in life, may have had very negative experiences with legal, educational, healthcare systems that have shaped their sense of safety in accessing services, and we can easily conjecture dementia care services later in life. This is also the case for younger people of different backgrounds today. People may have also experienced employment and housing discrimination, mattering for material security, fractured relationships with families of origin, and this continues to be layered with experiences of ageism, racism, ableism, and other forms of discrimination. With these challenges, communities have also found very creative ways of coming together. There's great importance and great strength among chosen families, friends, and community support networks, where traditional sources of care and support, including from government or formal care, may not have been suitable or welcoming, and also well-developed practices of mutual aid, collective caring, and negotiating healthcare encounters.
And kind of when we bring together the literature that exists within dementia, the dementia context, and 2SLGBTQI experiences of aging and old age, there's kind of a severely limited body of knowledge kind of within policy and practices and research that is relevant to the lived experiences of 2SLGBTQI people living with dementia and their unpaid carers. That being said, the research that is being done and recently has posited that perhaps lifelong social inequity, so systems of homophobia, transphobia, biphobia, or racism, experienced by 2SLGBTQI older adults and their communities may place them at an elevated risk of cognitive decline and/or developing dementia. However, the exact prevalence and risk of that is currently unknown. It's leaving it open for more research to be done. And that being, when we talk about research that has been done within these intersections, the majority of it is coming out of the UK, Australia, and the US. And so when we say context matters, what we know within the literature coming out of these spaces that are not within Canada, it's not necessarily directly generalizable to experiences of folks living here in what we call Canada. And so kind of giving these previous discussions of the intersections of dementia and unpaid care work, it's kind of reasonable to assume that caring for and with a 2SLGBTQI older adult living with dementia, or caring as a 2SLGBTQI individual, continues to be demanding based on what we know about caring experiences, regardless of historical rights or advances in rights and freedoms across the world. So kind of holding all that together, there's more work to be done developing a greater understanding and sharing of existing knowledge and experiences among 2SLGBTQI communities. More work to be done to explore conceptual frameworks for affirming care. So conceptual frameworks for trans affirmation or CRIT positive or age positive approaches. And also work to be done to engage possibilities for emerging forms of relationship, imagining different kinds of futures around aging and dementia. And all that is to say that without this greater knowledge and understanding that centers perspectives of 2SLGBTQI people living with dementia and their primary unpaid carers, the ability of government, of medical professionals, and others to provide equitable and comprehensive support and care is compromised, as is the ability to advocate for change.
Thank you. So with that, we'll move to our project background and orientations. So with all of that kind of existing knowledge, both documented community knowledge and what's in the literature together, I'd like to explain the launch of this particular project. So this particular project is housed at Egale, and we partnered with the National Institute on Aging to do the research for the project, and we're moving into the education phase. So recognizing this clearly identified gap in the research related to dementia and care, in 2SLGBTQI communities, as well as recognizing a growing need for shared knowledge, resources, engagement, and critical inquiry. Egale applied for and was granted funding from the Public Health Agency of Canada Dementia Community Investment Fund for a multi-phase project that would center these issues and these questions through research, education, and awareness. So today we're focusing on reporting back on some of the research that we've done in this phase so far.
And so reporting back on our project that the purpose of which was to gain a better understanding of the unique experiences and needs of 2SLGBTQI people living with dementia and their primary unpaid carers as they live in Canada. And so to do this, we were guided by the research questions that you can see here on the screen. So what is the current state of unpaid care as experienced or perceived by 2SLGBTQI people living with dementia and their carers who live in Canada? And then based on those experiences and perceptions, what can we learn about the aspects of care that are beneficial, detrimental, ignored, unfilled, or imagined? And so that's from the perspective of 2SLGBTQI people living with dementia, from the perspective of carers, and also from the perspective of service providers and key stakeholders. And so we're based on that feedback and those conversations and stories that we've heard over the past year, we wanted to take the suggestions and understand those suggestions and see what folks had to say about enhancing care and the provision of support as well.
Great. So to do so, and I'll speed through this slide a little bit, Ashley and I also established what's our orientation towards the research, what's our ethical orientation, conceptual orientation, what kind of methodology will we use. So we started with these 4 basic frames to think through. So first is the idea of appreciative inquiry. So this is stemming from organizational studies, was initially used as a way to initiate positive transformation of organizational culture. In essence, what it does is it's a basic process to begin with a grounded observation of the best of what is, and then encourage people towards thinking towards what might be or what might be otherwise. We also started with a focus on centering in interdependence. So a theoretical concept developed in feminist care ethics research and taken up across a broad range of feminist and critical disability analyses of care. Interdependence recognizes the inherent co-constitution and interreliance of human lives. So to give a basic example, rather than a binary of a caregiver and a care receiver, we recognize the carer and the person receiving care in a moment or cared for in a mutual relationship. This also helps us to decenter the importance often placed on individualism and independence, important when we're thinking about caring and about living with dementia. Third, we started with an orientation of assuming capacity, a phrase we adopted from the work by the scholar Ann Kohler. So to distill down what we took from this idea of assuming capacity is assuming that people can speak to their own experience, assuming that what they say can be taken seriously and should be taken seriously, against an automatic casting into doubt about the capability, the truthfulness of people living with cognitive disability and difference. And finally, especially working with and for 2SLGBTQI communities, troubling this idea of vulnerability that our communities are so often cast in, to focus also on strengths and creativity and challenges that people face, but people over populations. Bringing this forward, we then struck an advisory committee for this project and a related project to provide input through all stages of the research. we held national focus groups and interviews with 2SLGBTQI people living with dementia and unpaid primary carers. These were co-facilitated. And finally, we held a stakeholder consultation event, which invited back those focus group participants if they wished to participate, as well as our advisory committee members and a broader stakeholder group into conversation.
And now we're going to dive into some of the preliminary findings from this work, beginning with an overview of the study demographics. So starting with kind of the methods that we used to collect data in this study were a series of 2 phases. In the first phase, we conducted focus groups with about 5 focus groups, and then also about 2 individual interviews. And then that phase 1, we chatted with about 17 people total. And then as we went into phase 2, we held 1 consultation event with about 25 participants there. And so when you think about the first phase of our research, the participant profile for folks that we had the opportunity to chat with of folks living in central Canada, so that was Ontario or Quebec. And then we unfortunately didn't get the chance to engage with folks from the Northern Territories. And when we think about the age of our participants, there was kind of an even distribution across participant age groups. And notably, there was about 6 participants self-identifying as being in the range of 60 to 70 years of age, and then 2 folks were over the age of 70. And then when it comes to sexual identity, we had a range of folks as well. So we had 3 folks identify as queer, 5 as lesbian, 3 as gay, 1 as pansexual, and 4 as straight. And one of our participants chose not to share their sexual identity with us. And then when we think about gender identity, all of our participants self-identified as cisgender, and we had a total of 11 cisgender female or feminine identified participants, and 6 cisgender male or masculine participants. And then finally, when we think about racial identity, 2 of our participants self-identified as racial, and the remaining as white. And then when we think about and move into the second phase of our research, as Celeste mentioned, we had a range of folks at our consultation event, including participants from the focus groups, as well as members from the ad hoc committee, panelists that were invited to speak to identified gaps in phase 1 data, and also representatives from dementia care services. There was about a total of 7 folks from dementia care services, as well as general aging services and 2SLGBTQI stakeholder groups. And these participants were also distributed across Canada, with the bulk of participants, once again, from central Canada, so that was Ontario and Quebec. And then when we head out west to BC, Alberta, Saskatchewan, Manitoba, and also the Northwest Territories, we had about 10 folks, and then we had about 2 folks from the East Coast as well.
So what did we find? One of the first things that we asked participants on our focus groups, and namely the focus groups with the unpaid primary carers, was how did they become carers? So the pathways to becoming carers varied greatly. These included caring for a spouse or a primary relationship partner. They included caring for a sibling, caring for community members, which people may have been in this person's orbit, but not necessarily friends or best friends, as well as caring for friends. People gave many different kind of rationales, reasons, or their own stories of why and how they became carers in the roles that they did for the person living with dementia who they showed up for. So some expressed that they were born a caregiver and it was a part of their identities. Some responded with a sense of duty and also a sense of like, if not me, then who would do it? So showing up in the absence of others showing up. And there was also some expression of the sentiment that people didn't necessarily realize exactly what they were signing up for. For example, when they agreed to be an executor or an attorney for personal care, and how that rolled into perhaps a more intensive carer role. Significantly, participants also spoke very generously about how they brought past caring experiences forward. So this included from being a caregiver, previously a primary carer for other family members, so parents, children, and also from providing care in past professional contexts. So there were social workers, nurses, people with experience navigating care systems. Also, we had participants mention being involved in caring in circles of care for others during the height of the HIV/AIDS crisis. So there is a quote here up on the screen. I'm going to read aloud the extended quote. So responding to a question about how he had drawn on past life experiences towards his current caring role, one older gay man shared with us, "Well, the biggest thing is that I've done a lot of it in the 80s, caretaking, actually dealing with dementia with much younger men with HIV/AIDS. So there's not a lot of surprises in how someone may act. I think I've volunteered. It's kind of been what I've done all my life. A lot of that because we were in a big city in that era. That's kind of what you did, your caretaking. So this isn't new to me." Right? So this idea that, this is a new type of experience, but it's not entirely novel as people have past skills, experiences, and knowledge that they're bringing forward into their role as a carer.
Mm-hmm. And as we were thinking through all the stories that were shared with us, we kind of held the questions of what is 2S quote 2S LGBTQI about it? That is, what does gender or sexuality kind of have to these experiences of living with or caring for someone living with dementia? Kind of what are the key differences or what are the key commonalities? And so on a general level, when we were thinking about it with respect to dementia and caring, many of the participants shared stories about change. And so whether that was change in one's own abilities, so whether that's cognitive or physical abilities, or change in their ability to provide care to the level that is or was needed. And then as a result of this change, making choices around the pace of life, the engagement with others, and also with support networks as well. We also heard about change in a sense of self that kind of led to questions and fears around self-recognition. Folks sharing with us concerns about whether they'll remember who they are or who they love, fears around recognition. So that is whether organizations or service providers will recognize relationships or identities. We heard about change in roles, so shifting, as Celeste mentioned, from friend, partner, sibling, or acquaintance to carer, and the coordination of care and the juggling of multiple caring roles and responsibilities that kind of come along with that, or even negotiating kind of that reciprocal nature, our give and take of care as well. And then it's also not just change kind of within the caring relationship or primary relationship, but also with extended family members or friends, and what caring or living with dementia also does with and for other relationships as well. So we also heard about experiences of loss or grief kind of associated with witnessing some of the changes that I mentioned above or earlier. So grieving the loss of one's previous abilities. So for example, being able to play golf or cards with your friends, grieving the loss of one's partner or relationship as it once was, and accepting and moving forward and into a relationship as it kind of takes on a new or different form. And linking with the question of self-recognition were also stories about erasure, and specifically systemic erasure as well. So around heteronormative assumptions about relationships made when interacting with service providers. As you can see on the screen, one participant said, "I can't tell you how many times I've been asked, is this my mom?" So as interacting with service providers, providers wanting to place this relationship, whether it was a lesbian relationship, for example, into a box where it kind of made sense within this heteronormative frame, that the only option would be like a mother-daughter relationship or a sibling relationship, rather than a primary relationship. And there was also a talk about a loss of a queer identity as a diagnosis of dementia kind of starts to take precedence over other aspects of an individual identity. As you can see there on the screen, where the quote is, "Oh, they're treating her as a straight person. No one really talks about sexual identity or community when navigating care relationships and the provision of care." And we also had several conversations about aging in place and long-term care and what that could look like. Folks really advocating for wanting to live out their years with dignity and autonomy, and conversations around whether 2SLGBTQI specific spaces were a pathway forward or not.
And finally, people spoke very strongly about the power of support networks. So we asked them, where are you getting support from? What is working well? What is missing? And what is wished for? So one keynote here was the coming together of community in being there for 2SLGBTQI people living with dementia and their primary unpaid care. So people spoke about the presence or absence of families of origin or those they grew up with, the presence or absence of chosen family, so others who they may have made into family members throughout their lives. And significantly, there was a mix of straight identified folks around and queer and trans identified folks around in the support networks of people living with dementia. And people also spoke about the importance of neighborhoods and checking in on neighbors. And what that means is just a daily act of showing care and remembering also that people are still there. We also heard about experiences with general health care and aging services. So for example, participants expressed awareness about equity and inclusion practices being taken up within certain healthcare spaces. One person speaking to a hospital-based context shared the following. So I'm starting to see a lot more of the equity, oh, hold on. There's affirming pieces that are starting to come up and that I'm feeling better. And I've had that conversation with my cousin where equality, equity, there's something else. They're making that promise or that statement that all services or whatever, and I'm feeling better right off the bat, just because with those statements, I feel justified that I can go report and get something activated. And I have, and it's been dealt with. That's made me feel a lot better. And that's only been recently because we've seen little scenarios. But this has been new. And I don't know if it's a piece in all hospitals, but I feel better about that. So this person, unfortunately, reporting some adverse experiences, but feeling like with the awareness of these equity inclusion policies, they felt empowered to go forward and name those and had action taken. So this was very important to this person. Another person spoke about the importance of healthcare providers who employ 2SLGBTQI staff and doctors and who have affirming practices and then express the presence of community there and of those affirming practices. So as you see on the quote on the slide there, not to say that any of them, health services, are going to identify as not being queer friendly, but I think that it would be wonderful, and there would be more if there were more clinics that went out of their way to publicize that, to say, you know, we have experience in dealing with the queer community and with issues of dementia. I think it would be great if that was an option. And this sentiment is particularly telling in that in the focus groups as a whole, we heard about the role of both dementia-specific and 2SLGBTQI-specific services, but a real need for the coming together of, if not these two service areas to recognize and support, at least the shared knowledge or shared connections being made to better support 2SLGBTQI people living with dementia and those involved in caring for them. So some key takeaways from what we heard, and I'll also mention at this point that Ashley and I are currently working on the final report that will come out of this research, and this will be published in early next year. So this is a bit of a tip of the iceberg and a taste, so we'll have more to report on. But just for the purposes of today, so tips for providing affirming support: expand your understanding. So at a basic level, familiarizing yourself with 2SLGBTQI histories, working in the areas that you work or where you live to continue to reduce stigma surrounding dementia and 2SLGBTQI identities, understanding that these can intersect or overlap. Also, from what we heard in our consultation event and focus groups, there was a real emphasis on avoiding assumptions. So acknowledging and supporting intersectional identities. There was a great call to create more support groups for 2SLGBTQI people living with dementia and their carers, both in person and online, including after COVID, given the increased accessibility that can mean for some, for example, with mobility impairments or limitations, and reducing barriers to access to care. So including building more services for rural and small town communities where 2SLGBTQI people also live, right? A lot of services that do exist in urban downtown cores, which serves a very slim margin of our populations. And very starkly advocate for increased funding for dementia care. I think everyone's advocating for increased funding, but a real bottom line is that resources are needed. And as one consultation participant also put it, to improve mainstream services to better include 2SLGBTQI people that are more accessible and that silos don't work. So we really have to work together to do this. For next steps of the project, so I already mentioned our final report will be coming out in 2022. We'll also be moving into the next phase of this work, which is the creation of educational e-modules and guidance documents based on this research with what is already known in the literature and supplementary research. And these will be free and open access also in 2022. This project is linked up with the newly created Canadian Dementia Learning and Resource Network. So some of our material will be housed there, and I'd encourage you to check out some of the other projects that they're helping to support. And later next year, we'll also be working towards developing a national resource center on 2SLGBTQI aging, named very tentative, through a parallel project where this work will also come together. All of the research report and all the other project news will be disseminated through the Egale and NIA newsletters. So if you're interested in reading the report, seeing what's coming next, you can subscribe to our respective newsletters. The links are here. Egale, Get Involved, and NIA Ryerson, their newsletters page. and I both believe that both have very ethical unsubscribe options if you decide it's not for you. And finally, if you'd like to get in touch with Ashley or myself, we can be reached at these emails directly. Thank you.
Thank you so much, Ashley and Celeste. That was an amazing presentation. Truly appreciate it.
Thank you so much.
What I'm going to do is I'm just going to go ahead and share my screen just with a few closing out slides. Bear with me while I do that. It's always the pressure of which screen am I going to share today. Hopefully the right one is being viewed. So we do have a couple questions, but I'm really interested in the fact that your research findings are going to be out, you said, this time next year, correct?
The research findings should be out early next year. Through 2022, we're working on multiple things, but the report should be out early next year, and the e-modules and guidance documents, which will be free and open access, will be further to the mid to later next year, likely.
Exciting. So we will publicly make the commitment today that we would love to have you back to share your findings with our stakeholders and our networks here.
Awesome. Thank you. We'd love to. Ashley, I'll speak for us. We'd love to be back.
Great.
Go for it, yeah.
So let's jump into a couple of the questions that we received. Somebody was wondering if in your research study, if anyone from Newfoundland was involved.
So unfortunately, no. Specifically, not from the province of Newfoundland or Labrador. So we can't speak to the experiences of Newfoundlanders, but generally we had some engagement from folks on the East Coast, but not in a way that would be representative in any sort of way, unfortunately.
Yeah, thank you. An individual was wondering if you could just explain in a little bit more depth what the I at the end of the 2SLGBTQ means.
Yes, absolutely. So I stands for intersex. So Egale uses the 2SLGBTQI acronym, kind of how the acronym and communities are named and represented across organizations differ. I apologize. I have a puppy running around in the background. You may hear him. So I think what I'll do is I'll pop in a resource into the chat if you'll give me a moment to do that. Canada also just signed on to an important international agreement on protecting the rights of intersex people. So thank you so much for the question. And I'd like to send some resources to the audience, if that's all right with you, Laura.
Yeah, that would be great. Go ahead, throw it in the chat box. And while you're doing that, we are getting a request from a couple people in regards to your contact information again. So if you could just throw that in the chat box, it would be great. One last question. Would you be able to describe your recruitment strategy in conducting your research?
Sorry, struggling to unmute. Yeah, absolutely. So it was kind of a multi-pronged approach where we sent out a general call for participants kind of through our newsletters. So the NIA newsletter, the Egale newsletter. We also connected with community organizations in locations across the country. So community organizations both within aging care and also within 2SLGBTQI communities to help us distribute our recruitment materials as well as connecting with Alzheimer's societies across the country as well to help us with our recruitment. So it was a general call, and then through that, folks indicated their interest to us by filling out a form, and then we did a series of, it was a progressive ongoing consent model where we had an introductory interview with folks, got to know them a little bit better, and then funneled everybody into a focus group with folks from across the country, which was a really positive outcome, I guess, of COVID, is that we were able to engage and bring people together from various locations from across the country as well. So that was how we tackled recruitment and also getting folks into spaces. And we were hopeful that we would have a more large sample. However, I think while I say there was a positive to COVID, maybe one of the challenges associated with that was people's involvement in online spaces was at a max, maybe when we were doing our recruitment, and also recognizing the time and commitment for care and caring may not have been allowed space to participate in our research study as well. So
yeah.
I don't know if I missed anything.
No, that's great, Ashley. I do want to make all the attendees aware of the information that Celeste has put in the chat box. So just simply cut and paste it into your search engine and you'll be able to find that information. So what I'm going to do is just highlight a couple of our upcoming webinars. So October 19th, we're excited to be able to offer a very relevant webinar on MAID, medical assistance in dying, and looking at the impacts on patients and then, of course, their family and loved ones. So join us for this webinar. Mr. Al Gretzky will be part of this webinar, telling his story around his wife. So not to be missed. You can like us and follow us on all of our social media to be up to date on our upcoming webinars. So make sure you register for that. And then again, to get these wonderful ideas for our webinars like the one that you've seen today, fill out the evaluation. It will take you about 10 seconds. I promise you, we're all inundated with evaluations, but it really does help us focus on the content that we're sending to all of our attendees. So please take, it says a few minutes, but guaranteed 10 seconds. And then please connect with us. This is our phone number, email. Please reach out and connect. If you go to our website, you will be prompted to sign up for our newsletter. Lots of really great content in there. So I do want to encourage everyone to sign up for our quarterly newsletter. Again, thank you so much for being a part of our webinar today. Everyone's contact information is available, and the recording of this webinar will be made available at www.eapon.ca. Within a couple business days, you'll be able to view that at your own leisure. Thank you, everyone. Take care and have a wonderful rest of your day. Bye.